My name's Sagar, and I'm a student at Goodwin University in the Dental Hygiene program. Today, we'll be talking about recommendations for oral hygiene for your 3 to 5-year-old. In this video, we'll be covering topics such as the importance of dental visits for kids, the oral hygiene instructions for 3 to 5-year-olds, nutrition in relation to oral hygiene, and thumb sucking and teething recommendations.
I'm Kelsey, and I'll be discussing a child's first dental visit. A child's first dental visit should happen within 6 months of the first tooth erupting or at about 12 months of age. The first visit will not be very in-depth. It will mainly include desensitization techniques to get the child used to the dental environment. The child will also be provided with oral health education, a simple toothbrush prophylaxis cleaning, and a fluoride varnish application if the parent desires. Although during the first visit the child has their primary teeth and not their permanent set of teeth, it is very important to minimize cavities and help prevent their progression so that the child is healthy and bacteria is kept minimal. This way, the bacteria does not carry over to the permanent teeth, affecting them once they begin to erupt. A child's first dental appointment is a very important part of the process of building a permanent dental home. The child can create a relationship with the office, and they will be more comfortable for future, more invasive dental visits.
Hi, my name is Anastasia, and I will be discussing oral hygiene instruction. It is important to prevent cavities because they can cause pain and infection that may lead to other problems with eating, speaking, playing, and learning. Ways to prevent cavities are to brush the child's teeth 2 times daily for 2 minutes. Try making the brushing experience as fun as possible. Help your child brush their teeth until they develop good brushing skills. If your child is younger than 6, watch them brush. Make sure they use a pea-sized amount of toothpaste and spit it out rather than swallow it. Ask your child's dentist to apply dental sealants when appropriate, professionally applied fluoride, and to drink tap water that contains fluoride.
Hi, my name is Letty, and I'm going to continue talking about oral hygiene instructions. Early childhood caries, or ECC, is a cavity seen in primary teeth in children. It's actually 5 times more common than asthma, and it's the #1 reason kids miss school every day. ECC affects infants and preschoolers worldwide. Some signs you may see for ECC when inspecting your child's teeth may be white spotted areas. If these are visible, you may want to consult with a dentist as he will do a further examination to see if these are carious lesions. If these white spotted areas progress, they may result in cavities forming. Some contributing factors to the development of ECC include improper oral hygiene practices, abundance of bacteria in the oral cavity, dietary factors, or bottle feeding. When your child is brushing their teeth, you want to make sure you monitor them. When they're brushing, you want to make sure they're doing circular motions in all surfaces. So you want to make sure they're cleaning in the outside, as well as the inside, as well as the biting surfaces and the tongue. When they're cleaning the tongue, you want to make sure they're sweeping to remove all bacteria.
My name is Melissa,
And I'm Kim.
and we're going to talk a little bit how nutrition can impact your child's oral health. It's important to make healthy choices when talking about nutrition. Some healthier foods include fruits, vegetables, a variety of proteins, dairy products such as yogurts, milks, and cheeses, and to drink water throughout the day. A great resource is called My Plate, which is a government website that helps you plan food choices for your child depending on their height, weight, and age. It gives important dietary and lifestyle recommendations for children, including to stay active at least 30 to 60 minutes a day. The My Plate guidelines are good to give you an idea of how much and what your child should be eating to maintain a healthy lifestyle, including maintaining a healthy oral cavity. It's important to also limit sugary drinks, foods, and carbohydrates. Some tips to help maintain a good oral health when thinking about nutrition is to keep fruits and vegetables in your house as healthy snacks instead of carbohydrates, to serve cheese with meals or as snacks as a good source of calcium. Calcium is an important mineral when talking about dental health and keeping your teeth strong. You also want to avoid chewy and sticky foods and serve sugary treats with meals, not as snacks. You want to get your children into the habit of eating as few snacks as possible to avoid the exposure of carbohydrates to their food or to their mouth, which Kim will discuss later. And you want to avoid any sugary foods that linger on the teeth for a long time, such as jelly beans, candy, stuff like that. Also, lastly, it is important to have a well-rounded diet so that kids are getting the adequate vitamins and minerals that they need.
For your children ages 3 to 5, limiting carbohydrates help protect the child's teeth from developing cavities. Carbohydrates like crackers, chips, and cookies break down into sugars during chewing. Bacteria then digest the sugars and create acid. Acids can erode the enamel of a tooth, creating the beginning stages of cavities. It takes about 30 to 40 minutes for your oral cavity to neutralize the acids and stop your enamel from breaking down. Instead of continual snacking on carbohydrates, limiting the amount of carbohydrates that a child eats and replacing those snacks with whole grains, fruits, and vegetables will help create a well-rounded diet. When dealing with picky eaters, the following tips may come in handy. One tip is to allow your child to help pick out your fruits and vegetables during shopping. This may make them more interested in trying new fruits and vegetables. Another is to offer one new food item at a time. Do not be discouraged if they don't want to eat the new fruit or vegetable. Often trying them multiple times will help change their mind.
My name is Kylene, and I'm going to be talking about thumb sucking. Children tend to suck on their thumbs as a means of comforting themselves and or to help themselves fall asleep. Pacifiers and thumb sucking essentially affect the developing teeth the same way. The severity in which thumb sucking or pacifier use can cause a problem is typically dependent on whether the child just rests the thumbs in their mouth versus them aggressively sucking on the pacifier or thumb. The aggressiveness of the pacifier or thumb sucking is when the problems with the primary teeth and permanent teeth can be seen, and orthodontic work might be necessary to correct the problems. Children tend to stop sucking their thumbs by age 2 to 4. Thumb sucking is typically not considered problematic for your child until they are around 5 years old. At this age, thumb sucking can start to contribute to oral health concerns like a misaligned bite.
Thank you for watching. We hope you found this video useful.
If you want to visit us, you can visit the Goodwin University Dental Hygiene Clinic located at 403 Main Street in East Hartford, Connecticut. See you soon!